Councilmember Derek Green, and welcome to our first virtual public comment. Now, normally we'll be in our studio having an interview and talking about the issues of the day, but due to COVID-19, we've had to change our format and go to this new normal. So we're coming to you from Zoom, and we've learned how to use Zoom and other platforms like Microsoft Teams to do the work that we need to do. Due to COVID-19, we've had to make a lot of changes, and so we thought it'd be important to have a special guest, Dr. Valerie Green Amos, who also happens to be my sister, to give us some great information regarding COVID-19. So stay tuned for more public comment.
I'm Council President Darrell Clark. It's crucial we stop the spread of COVID-19 in Philly. So follow this advice from the doctor and his friends. Stay home, keep social distancing, wear a mask when outside. Let's stop the spread.
Hi, I'm Julius Dr. J. Irving. In the middle of the coronavirus outbreak, best way to show brotherly love and sisterly affection is by keeping your social distance.
Now more than ever, we all have to do our part to help save lives. That means staying at home to stop the spread.
We all need to do our part to save lives. You know what that means? Stay at home, stop the spread. We can do this together.
Did you know that the Free Library's robust collection of digital resources can be accessed from anywhere with your library card? Enjoy ebooks, audiobooks, movies, TV, magazines, homework help, online language courses and professional development workshops, and much more, all from the comfort of your home. Visit freelibrary.org and select Databases or Digital Media to get started now. All you need is your library card and PIN number. Find us online. We're here for you.
Welcome back to Public Comment. This is our first ever virtual edition of Public Comment. For today's session, we're going to be talking about COVID-19. Joining us as a special guest is Dr. Valerie Green Amos. She's a graduate of Temple University School of Medicine, and she did her residency at the University of Maryland. She is a geriatrician where she's managed a number of practices and physicians and has an expertise of working with seniors and done a lot of work regarding the impact of COVID-19. So welcome to Public Comment, Dr. Valerie Green Amos.
Thank you, Councilman Green. It's a pleasure to be here and coronavirus pandemic as we know it today. So thank you.
Now, one other thing, if you haven't noticed, the last name is similar because Dr. Valerie Green Amos is my sister. In fact, we graduated on the same day, she from Temple Med School and me from Temple Law School. But it's a pleasure to have you in your official capacity as a physician. So give us a little perspective on COVID-19 for people here in the city of Philadelphia. We know it's had a very disparate impact on African Americans and other people of color. What's been your experience with COVID-19?
Thank you for that question. So COVID-19 has impacted millions throughout the world. But as we look at urban centers like Philadelphia and other cities throughout the country, where there are a large number of people who are underrepresented minorities, African Americans and Latinos in particular, what we're seeing is that there is an incredibly high or disproportionate rate of those individuals contracting the virus and having very significant side effects, even death. So when we look at the number of different ethnicities that are represented throughout the nation, what we're seeing is that those who have to perform the duties as quote unquote essential workers are those who are most impacted. And those individuals tend to be working class people who have the responsibility of going out day after day to ensure that we have basic necessities like food and housing and cleaning and so many different things. People who are in public transit, people who work in civic service duties and responsibilities, those individuals have had to be out amongst the community of people who have in some situations not been as responsible with their social distancing practices and safe at home recommendations. As you know, as a public servant in the city of Philadelphia, many different strides have been taken to try to protect our public health, to try to protect the public health of all citizens throughout the nation, and really throughout the world, has been based on two very specific premises. One is excellent hygiene. So hand washing, wearing a proper cloth-based mask or a surgical mask, and then exercising appropriate social distancing and staying at least 6 feet away from people. The challenge is that some people don't have a choice. Some people have to be in close contact, or at least in the beginning of the pandemic, of course, had to be in close contact with individuals, which put them at significant risk of contracting the virus. And when one looks at who those individuals are, disproportionately, they have been Black and brown individuals throughout this nation. It's very interesting to see, again, even in the healthcare segment. As a physician, I've had the opportunity to work on telemedicine, which means that most of the patients that I'm engaging with now, I'm doing it from a distant platform. I'm doing it from a virtual platform where I can call a patient and have a video chat, and I can see different problems that they may be experiencing using technology. But imagine for all those people who don't have access to that kind of technology for their jobs or their employment, and they need to earn a basic wage to care for their families. And these persons tend to be disproportionately Black and brown people. Again, even in healthcare, when we think about those persons who are in the front line, nurses and nurses' aides and medical assistants and technologists tend to, again, be persons of color, disproportionately having no choice but to try to find a way to take care of their families and thus exposed to the virus. And then once they bring the virus to their home, that if they're living in multi-generational homes or have elderly parents or persons who may be at higher risk due to comorbid conditions such as diabetes, hypertension, chronic asthma, or chronic pulmonary disease in particular. And then the one that's most indolent, which is obesity. Obesity seems to be the greatest risk factor for developing complications of COVID-19 because of the fact that this is mostly a respiratory disorder. And so when people are heavier than average or defined as obesity because of their body mass index, that they tend to have problems with breathing and thus have worse outcomes when it comes to COVID-19. So again, and there's lots of rationale and deeper dialogue that could come from that particular summary, but that pretty much adds up to why we're seeing so many cases and people who are identified as African American or Latino in the United States, and in particular African American in Philadelphia.
Well, that was a great, very thorough overview of COVID-19 based on your experience as a physician. We here in Philadelphia and in the Commonwealth of Pennsylvania have been sheltering in place since mid-March. And I remember from the early part of the pandemic when the daily calls I was doing with the mayor and Dr. Farley, our health commissioner, we were seeing infection rates of about 600 or close to 700 new infections per day. We're now averaging about 100 new infections per day. So we've been doing a good job by wearing our mask and engaging in physical distancing, like you said. And so one of the concerns that I see going forward is that we need to make sure that we're continuing to wear our masks. So as we're getting into the warmer months, what would you say in reference to how we continue to protect ourselves? Because people want to be out, they want to engage, they want to enjoy the sunshine, and they've been sheltering in place. So how do we stay safe as it gets warmer?
That's another great question. So the reality is that people are tired, and they're tired of being told what to do. But I'd rather for all of us to be told the precautions that keep us safe versus have increased rates of coronavirus that are affecting our communities. So masking and social distancing are the bottom lines. We've seen this evidence through what's happened in Europe prior to what happened in the United States, what happened in Asia prior to Europe. So the precedence has been established. When individuals wear masks and exercise social distancing, then the rates of coronavirus tend to decline. What has happened is people have been, in some places, quite irresponsible. And because of the lack of responsibility and accountability, not only have they been spreading the virus, but we've seen in some states, specifically in the West Coast and in the Southeast, incredibly high rates of hospitalization and new infections over the last few weeks. The other major concern is whether or not the federal government will continue to fund the testing centers. So unfortunately, the leader of this nation, we'll call him, has been quite complicit and irresponsible with sharing information and, again, providing opportunities for individuals to be tested. What we know is that in Philadelphia, there's been a tremendous sort of grassroots movement around testing people of color in particular, but ensuring that people had access to testing, because knowledge is power. And as we know, if someone is responsible and thoughtful and they know that they've been exposed to a virus, the hope is that they would take those precautions, and their family members and household contacts would also take the same precautions to keep us safe. So regardless of the fact that it's warmer and it's beautiful outside, people can still go outside, but the idea is to ensure that you are not spreading this virus unbeknownst to you to people who don't have the safeguards because of their immune system to protect themselves from extreme illness. And what we've seen over the last few weeks, just since Memorial Day, and really it started around Mother's Day, that there was an uptick in cases of individuals who were exposed via their loved ones. I had one patient, I've only had one patient pass away, and this patient has been housebound, homebound for 2 years. But between Mother's Day and Memorial Day, sometime in that timeline, one of her well-meaning family members brought the coronavirus to her home, and unfortunately, she passed away. So these are the kinds of stories that are happening throughout the country. These are the kinds of issues that are occurring because people are being hasty with their thoughtfulness around social distancing and basic hygiene, as well as, again, the prevention of spread of respiratory droplets through the use of wearing a cloth-based mask. So again, it's about our own individual accountability, but it's also about how we as individuals support the health of our communities. And the only way to do that is to ensure that we're exercising social distancing. There's no vaccine available. There's really no aggressive treatment available. Right now, we just treat symptoms as we see them, but there is no cure for this virus. So as we know there's no cure, then prevention and precautions are the best way to ensure that this virus does not continue to cause extreme illness and ultimately death.
Well, I want to thank you, Dr. Valerie Green Amos, for your information and providing all of our viewers on public comment with that vital information. I know you know a lot of the people in the Black Doctors COVID-19 Consortium, like Dr. Ayla and Elena, friends that you've known for a number of years. And I know you have been supporting them and supporting the work they're doing. Thank you for your great information. Thank you for the work that you've done for a number of years. And also thank you for being my sister. So with that, I want to thank you, Dr. Valerie Green Amos, and we'll be right back with more public comment.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Did you know that the Free Library's robust collection of digital resources can be accessed from anywhere with your library card? Enjoy ebooks, audiobooks, movies, TV, magazines, homework help, online language courses and professional development workshops, and much more, all from the comfort of your home. Visit freelibrary.org and select Databases or Digital Media to get started now. All you need is your library card and PIN number. Find us online. We're here for you.
I want to thank Dr. Valerie Green Amos for providing us with that great information regarding COVID-19. It was also great to have her as a guest on the show because she's also my sister. Now, we've done a lot of great things here in the city of Philadelphia in stopping the spread of COVID-19. Me and my council colleagues have been doing a lot of work with the Mask Up PHL social media campaign to make sure that we are stopping the spread of the coronavirus in our city. Although it's getting warmer, we need to make sure that we are still doing all that we can to stop the spread of this disease in Philadelphia. Now, COVID-19 had a major impact on our city budget. We just wrapped up our budget process, and we were able to address a $750 million hole in our city budget. We also had a lot of unrest in our city due to the tragic killing of George Floyd, also in reference to Breonna Taylor and Ahmaud Arbery's tragic deaths. And so we've heard from people in our community. We made some historic changes in our budget, especially in reference to police, and we're continuing to make additional reforms as we listen to the citizens of the city of Philadelphia. So we need to stay on the forefront trying to address these issues in our city. We also need to make sure that we stay safe. All of you who are watching Public Comment, continue to be safe. Let's stop the spread of COVID-19. I look forward to seeing you next time with more Public Comment.